without moving their eyes a lot. And so this part of our presentation is actually just another chance to go around in the audience and ask them if they have any questions. And it doesn't actually like when I have these glasses on, it's hard to turn. I have to turn my head, but you don't actually have to turn your head with glaucoma. You have to move your eyes because it's your eyes that are not your head, not your eyes aren't paralyzed or anything. The other thing is, if they have any questions about how clean the glasses are, we do clean them after every presentation. So, okay, so David is actually one of my friends from my classes, and he's president of our organization, and he knows a lot about this, so he's going to talk to you about it. Come on out.
Okay, so one kind of really cool thing to do in the presentation, at least I've seen, is that whenever a new presenter comes up, they can introduce themselves again. Karen introduced herself in the beginning of the presentation. That's all really great. Everyone loves to, just hear your name and that sort of thing. So you can just say, again, say, hi everybody, my name's David. I'm going to be talking about the next part of the presentation. And great, let's get started then. So the reason we're talking to you all today about this is that glaucoma is a very serious health issue here in America and California. Throughout America, 3.5 million people have glaucoma and they're losing their vision because of it. And there are millions more that we're not diagnosed with the condition, but are also losing their vision to glaucoma. It's a serious health issue, and it's really sad because if the disease was caught early, vision loss could have been prevented. So that's why we're out here today. We're here to talk to all of you and tell you how important it is to go for annual eye care examinations. Great. So I'll talk to you more about at-risk groups for glaucoma. Everyone is at risk for glaucoma. That's the major issue we're trying to take home here. However, studies have shown these groups tend to be more at risk for glaucoma, and if you're in one of these groups, you should take that into consideration. Those with a family history of glaucoma, me included, are more at risk for the disease. African Americans 50 years or older, or Hispanic 65 years or older, tend to have higher rates of glaucoma in their families as well. Fortunately, there are many treatment options available for glaucoma, as Karen earlier alluded to. And all these options are safe, and they're very effective at treating the condition, preventing any further vision loss from occurring, but again, if the disease is caught in its early stages. So, what are the options? The most basic option for treatment is intraocular medicine. A couple of eye drops you put on in the morning and the night helps keep the pressure in the eye under control and helps to prevent vision loss from occurring. Surgeries are also available that can help the fluid to leave the eye more easily, which would also benefit to keep the pressure in the eye low and help prevent glaucoma from occurring. And fortunately, these eye exams are all free under Medicare. There are a lot of benefits, and if you're able to go with Medicare, you get one free eye examination a year, which is exactly what we need in order to keep yourself keep up to date if you have these glaucoma, so you get early diagnosed. And most insurance programs also offer opportunities for annual eye care examinations. Speak to your insurance about that. It's very important to look into opportunities and take advantage of getting the annual eye care exam. So what is the eye care exam like? Usually people have a lot of questions about this. It's a very basic, non-invasive procedure, half an hour to an hour. All they're trying to do is look at the back of the eye and see if this cupping motion that happens with glaucoma, we mentioned earlier, has started yet. So what they would do is they would dilate the pupil with some eye drops, and they would use their lens to look in the back of the eye and see if there any vision loss had occurred. I'm sorry, see if any damage to the optic nerve had occurred. Other exams include, if people have questions, you can say other exams include a air puff test where air is puffed against the eye, and then the rebounding air can help to figure out the pressure, or a tonometer where a device is touched to the numb eye. When you numb the eye first off, you touch this device to it and it measures the pressure. But the most comprehensive way to detect if you have glaucoma, and if you have other eye diseases as well, these detect other conditions like macular degeneration as well. People have questions about that a lot. These eye exams are very effective for that, and that requires a full eye exam with a dilated pupil. This is a slide we added for people who have a lot of questions about what you can do to help your vision. A lot of things we can do to help. There's a lot of things we can do every single day to help our visions besides going for annual eye care examinations. Of course, the big thing is to make sure you're staying active, eating right, and making sure to protect your vision from UV light by wearing sunglasses. A lot of diseases like macular degeneration, glaucoma are aggravated by wearing by looking at a lot of sunlight and that sort of thing. So if you're going out and about, make sure you put sunglasses on. And have a varied diet full of different vitamins and minerals that are necessary to keep your eye working well. Also, if you're also smoking tends to cause more vision problems because the particles get stuck in the eye. So you don't want to do that as well to keep your vision healthy. Great. So that was our presentation. Thank you very much. We hope that you answered your questions. Any questions right now, please ask us. Our main message is to really go and speak to everybody and ask them to go for annual eye care examinations. That's what we're really trying to do with Vision for Vision, this organization. And we have more information over here on the table. And we'll be hanging around a little bit. If you have any questions to ask us, please take advantage of Medicare benefits or other insurance benefits. Go for annual eye care exams. The eye exam is free, but vision is priceless. So thank you very much. Great. So that's what the presentation would be like. In terms of what would happen now, usually there's a good amount of people who are wanting to stick around and ask questions. We should make sure you answer their questions. And we usually have a lot of material available for that. Great. So we talk a little about how. All right. So we're going to talk a little bit about how we set up the presentation. When we usually get there, we'll have our projector and our board, which is kind of usually just pretty simple to set up. It's kind of unwieldy, but beyond that. And what's a good thing to do is to have one table somewhere in the vicinity where you can just sort of put down a lot of information about glaucoma and about what we're trying to do here with Vision for Vision. Let me set it up first and then I'll take the camera and look at it all. All right, here is a quick recording. Okay, let's start again. Here's a quick recording of our table, what it's going to look like. We have all these different materials and boxes, and we'll set them up when we get there. We want to make sure we give out our own Vision for Vision handouts first, ones we print out over here on the right. And then we have here the Medicare, the National Eye Institute small blue handouts. Then we have our Vision for Vision handouts that have Dr. Francis' information on them and nearby medical centers. These are the ones we want to give out to anyone who's interested, and because it has all the information from our presentation. We have our just general Vision for Vision stuff, Medicare benefits, and Dr. Francis information. So anyone's interested, give that to them. Now we have other pamphlets too. However, we are a little bit limited supplies of these, so give them out to people who are really interested and have particular questions. Here's one for diabetic eye disease. People have a lot of questions about that, so you can hand out this pamphlet for that. Here's more information about glaucoma. You can hand out this pamphlet regarding that. People who are interested in our organization, like as an organization, you can sign up and grab these different V4V magazines. This is our quarterly newsletter, and sometimes they have articles people may be interested in as well. And now these blue books are really, really informative, and if people are interested in glaucoma, very interested, want to know more about it, you should definitely give them one of these things. And these are the different, these are the packets we send to senior centers or community centers we want them to present, to have them let us present. It has information about us and a little DVD about us and that sort of thing. So